Hello, welcome to Sama Saturday. We're so happy to be here with all of you. Sama Saturday is Sama Dog's ongoing show that brings our attention to various topics in the realm of natural, holistic, spiritual living with our animals. So that's what this channel and our work is all about. This show today is themed to pain management for our pets. So this is a conversation and a topic that has come up a lot to me lately in our lives with our animals. There's just been a lot of limping and inflammation and issues in their physical bodies. And that really brought my mind to want to bring this conversation forward to all of you, especially with the teacher, the brilliant being who is Dr. Katie Kangas, who just joined us in here. Again, here she is. Hi, Dr. Kangas.
Hello, can you hear me okay?
Yeah, you're looking and sounding good.
Okay, good. Actually, I just realized my headphones are not plugged in. Let me try that and see if it's any better or different.
Okay.
Any better?
Great. About the same.
Okay, great.
So
okay.
We're good.
Yay.
Yeah, so I was just sharing that we are talking about pain management for pets today, and we love learning from you, Dr. Kangas. So this beautiful woman here, in case you don't know her, is one of the most amazing vets in the country. She is stationed in her practice down in Southern California in San Diego called Integrative Veterinary Care. So you can go there if you're in the vicinity, or you can have consultations with her. But she comes to our show often and is a person that has taught all of us so much about our animals, and all from the natural perspective. And that's what we'll really get into today, is what can we do naturally to help our pets, and when and where and why, and all of your questions will also be answered. So without further ado, I'll just go ahead and turn it over to you, Dr. Kangas, and you can tell us, maybe kick us off with, where should we start in learning about pain for our animals in our lives?
Thank you, Amanda. And again, it's my pleasure to be joining you and, just connecting with everybody today in this wonderful forum. And Amanda suggested this topic, which I was very appreciative of, because it is a very important topic. And it's certainly something that pet parents ask about all the time. And we all know, because we've all had pain in our own bodies, we know how how that feels and how uncomfortable things can be. And it, of course, pains us to see our pets experiencing that and wanting to do whatever we can to identify it, hopefully prevent. We're going to talk a bunch about prevention and proactive, formats in this whole topic, but then also how to address it, how to recognize it. And so to answer your question a little more directly, Amanda, what I would say in knowing about pet pain, or really trying to realize more about it, is that most people are probably familiar with the fact that animals tend to hide pain much better than humans. And everybody's individual, and some pets are going to be more stoic than others, and some breeds may have the tendencies to be more stoic than others. But really, often pets will hide their pain. And so we want to be on the lookout for cues, and we can talk about what those are, to sense that your pet is having some discomfort or some issues. So if you want me to launch into that, or if you want to direct.
Yeah, I think that's great because, as I mentioned when we opened, there's so many of us that do face this. It comes and it goes. Well, obviously every animal's different, but it's also something that comes and goes. And I think one of the curiosities that I've had is like, what's causing it, in addition to the obvious, like when Violet yesterday climbed up and down this big, tall, super steep mountain and then couldn't get up at the end of the day. That was obvious, but sometimes these flare-ups come. So yeah, I think starting out with causes, and we'll go from there.
That sounds great. So I made a little list, actually, so I would include everything that that was coming to mind. And the most common cause of pain in pets is going to be musculoskeletal related. So arthritic pain, joint pain, back pain is a big deal for a lot of dogs, and neck pain, what we call cervical, in the cervical spine. And that kind of goes in the whole category of back pain, but can be very specific with its symptoms and how the pet will, act during that. So arthritis pain, joint pain. And by the way, it's estimated that at least 20% of dogs have arthritis. So it is a very, very common thing. And they don't have to be old to have arthritis, because there's a lot of congenital growing things that happen with dogs skeletally that will lead to early age arthritis. Most people are familiar with the term hip dysplasia, and that occurs as a congenital growing thing and will place the animal's body into an early, arthritic kind of a condition. So, and there's also elbow dysplasia and shoulder dysplasia and things like that. So they don't have to be older or geriatric to have these issues. Weight is, being overweight is definitely a component, and we can talk about that too. It has also been under-recognized how many cats have arthritic and musculoskeletal conditions too, by the way. And so we're recognizing that more and more. So joint pain, arthritis pain, back pain, and spinal pain. And then other categories would include gut pain. And interestingly, with pets, we oftentimes, veterinarians or pet parents, can have trouble distinguishing between back pain and gut pain, okay? Because when the stomach hurts, and obviously, it's close to our spine, but you can imagine the posture of a dog. When the stomach hurts, it can seem like back pain, or vice versa. Sometimes, it's misconstrued in either direction. So that is something to, try to decipher. But gut pain can be a very serious thing. And then also other that would be a little less common, but things like oral pain with dental disease, that's definitely can be an issue. And then a little less common would be things like bladder pain if there's stones or bladder infections or things like that. Maybe a chronic eye condition like glaucoma is known to be painful, those kinds of things. So those would be in lesser categories, but certainly things that we see.
Mm-hmm. Yeah. And I'm curious to know from our audience here, I've got a little question here for you. Who, you can answer with a yes or a no in the comments, if you will, who currently has or is caring for a pet who's dealing with pain, either ongoing or occasional? We'd like to know kind of what's going on. Where do you think the pain is? So you can say yes or no, and then maybe a location, so we can get a good gauge. And I also invite all of you to ask your questions throughout. Tell us what's going on. We'll definitely, as we touch on the different topics here, we'll definitely take your questions and toward the end, and let us know your stories, your anecdotes, your experiences through pain in your pets, because, that's what really helps us to be able to have a conversation that's meeting your need also. Of course, we've got our topics, but it's always helpful to know what it is that you want us to be sharing. And speaking of sharing, if you will take a moment right now, this is such an important topic for all pet parents, whether your animal's dealing with pain right now or not. It is likely, just like in our lives, we will have that come to fruition at some point. So such an important conversation. Many people don't have a vet to access in this way and ask these questions to, especially from a holistic perspective. So please take a moment to share this, get the word out there. I know lots of you have a very animal loving community, so this will really help people all around the world. And we always are so grateful for Dr. Kangas for that. So willing to share her knowledge so openly and generously. So so we've talked about the causes and kind of where some of these pains come from, and how, this is one that you mentioned. Oftentimes we can't tell if our pet is in pain. So what are the signals or the symptoms that we should look for?
So many, and I will go through a list that will be helpful for everybody. And so some of the things that you want to look for is certainly appetite changes. Okay, so if their appetite is reduced, or they're getting more finicky, and that was not their nature before. A lot of dogs, people are like, they won't eat their food anymore, but they'll eat their treats. And, and it may be other things surely in that picture, but definitely pain would be something I would be thinking about. Are they uncomfortable so that they're not eating what they would typically eat? Okay. Then other kinds of mood changes. And that could be anything from seeming depressed and certainly lethargic and low energy to being grouchy, or being anxious, if they're panting a lot and they're restless and they can't find a comfortable, they're getting up and kind of circling around and then laying back down, and, just seeming like, and interestingly, I want to share a story right now about the grouchy mood thing, because I just had experience with a wonderful feedback that literally made my day. A few weeks back, I was meeting for the second time with a pet parent with a female Rottie, okay? And this person, her husband's actually a dog trainer, okay? A professional dog trainer. So they really know how to read cues. And this Rottweiler, they have little children in the house. And this Rottweiler, she was telling me, was just this was gut pain. So this is a really interesting story to share, is that this Roddy, excuse me, was having chronic gut issues. And she was so restless in the middle of the night. She was panting. She couldn't sleep. She was just, really out of sorts. And she was certainly having regurgitation issues and gassy, gut and loud gut noises and all this kind of stuff. And she didn't really comment too much on the mood until the second session, 1 month later. And some of the things, hopefully, that I recommended for her, we might get to today for me sharing. But I gave her a little regimen. We talked about, some initiating diet changes, put her on a couple of supplements and things to calm the gut down. A month later, we met again. And she said, she is so much better. Like, she's a whole new dog. She's literally only had 2 episodes of visible gut pain in the prior 30 days since we had met. And this was the coolest thing that made my day. She said, and you know what's really the best marker is, she's like, my 6-year-old daughter said, hey mom, I can step on her head now. And she doesn't even get mad or grouchy or growl. Like, I didn't realize, she said they were just sort of tiptoeing around this dog, because if they got too close to her, she would lift her lip and growl, or she would just, she would respond very grouchy and very moody. And she said, it's to the point where my 6-year-old can play around her and fall on top of her and walk on her. And she's like, la, 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 I'm fine. And prior, she was super grouchy, and they were, walking on eggshells around her. And that is a really remarkable. And I mean, of course, that made my day. I'm like, wow, this dog's quality of life and the whole family's quality of life was improved because her gut pain was resolved.
It's a common occurrence I hear is aggression or reactivity, and people will start working with behavior and hire a trainer and try to figure out why this dog is acting this way all the time. It just wasn't pain. Think of us. We get grouchy when we're in pain too.
Exactly. So that was a really nice story to share the magnitude of, how that can show up. And then some other things besides mood changes, lethargy, less energy, that sort of thing, would also be reluctance to do the physical activity that they would normally do. So not wanting to go on walks, or wanting to go as long, or avoiding the hills, or having to stop and rest, avoiding stairs, or doing obviously poorly, on the stairs, slowness or reluctance to get up or to lay down. Sometimes that's a more subtle one that people don't see. It's just taking them longer, to get up or down. Difficulty jumping, not being able to get up on furniture or in and out of cars, that sort of thing. For kitty cats, by the way, one of the things, as they get arthritic and painful, they may start going outside the litter box, because it's difficult to get in and out of the litter box. So there's also boxes that are made, or you can revise your own, so that there's a little lower section where they can get in instead of having to climb over all the time. So that's another thing. And then other cues that your pet may be in pain would be they're reacting to your touch differently. When you try and touch them, they either flinch or cower back, or, things on their body move a little more reactively. And, that would be, I think, probably a pretty good list of things that I would encourage people to be on the lookout for.
I saw someone here in our comments that said, Susan says, my pup has had digestive issues and would never let us rub his belly.
Yeah,
so that's exactly.
Thank you, Susan. Yep, exactly. So the touch piece, and then the fact that, gut pain is a real thing. And sometimes, by the way, I suspect that pets are actually having gas pains. And I mean, most of us have experienced gas pains at some time in your life, in your gut, where they're like show stopping. I mean, you're just standing there and all of a sudden, it is like really painful for a few moments or even minutes. And pets can experience that too, where it's almost like this acute pain that passes relatively quickly. If you see that, it's more likely to be gut pain than perhaps other things.
And Dr. Katie, before we move on, I just want to highlight one thing that I've noticed a lot with pet parents is that, like we said, we can't tell they're in pain. Will you just speak a little bit to the not the severity, but the degree to which that's true, like that the animals won't show it? Because I think a lot of times I'll speak with people and they'll say, I don't think he's in pain. He doesn't seem like it. But, and without like bringing us down here, I just want to tell one quick story or just one example that when you see like overseas, I follow like the dog meat trade and things like that. And there are some of these dogs that are so injured. I mean, they've been skinned or dismembered. And you will see that dog in these videos and it's just sitting there. It will even wag its tail sometimes. When like a kind person will come up, it will still wag its tail. It'll
Right.
even like a couple times, it'll do like a little doggy smile. So it always gets me thinking when I see that, like, wow, the degree to which they don't show it is pretty extreme. So I just want to highlight that a little bit and hear from you
Yeah.
too.
I agree. And, thank you for putting that into light, because it's true. And again, different breeds and different individuals may be more stoic than others, but as a general rule, animals hide pain. That's an evolutionarily, appropriate tactic for them to survive. And they haven't been domesticated all that long, really, in, the expanse of time. And so it is very common for them to hide things. And so, yes, I would encourage people to be as in tune as you can. Use the discussion points that we're having today to really be on the lookout, but don't necessarily assume that just because you can't tell that they're not in pain. And another example along these lines would be, most people know that I have a big background in dentistry. And so I focus a lot on oral health as not only a very important piece of whole body health, but there's a lot of oral issues that may be under-recognized because they're hidden in the mouth. And so we call this a hidden source of inflammation. People aren't looking there. Well, case in point in our pain discussion is that animals almost always, dogs and cats, will eat through incredible oral pain. And people are like, well, it can't be the mouth because they're eating. Yeah. And I mean, they will have dental abscesses. They will have their face, blown up with swelling. There's pus pouring out of their mouth and they're eating. And if we had that kind of dental pain, I mean, it's excruciating. I mean, we'd be sitting there with our hand on our head until we could get into an emergency oral visit, yes. and these pets are eating. And so, and when I worked with the board certified dentists, what they would often say, people would call and say, I think it's the tooth, my pet's not eating. And they're like, well, it's almost never the tooth, but we want to see them anyway. There are a few select conditions where it might be the mouth, but usually it's not in preventing them from, eating. So that's just a good example to demonstrate that indeed their pain can be really significant and we may not know.
So good to highlight that, to remember that for all of us. So before we get into treatment of the pain, what about before that? How do we prevent it? What can we do proactively?
I love that. And from my personal point of view and approach, but also from a holistic, whole health approach, we always want to be in the most proactive and prevention phase that we can. And Western medicine, conventional medicine, tends to be in the reactive phase. You wait till you're sick and then you deal with it. You wait till you're in pain and then you deal with it. And so I love that we're bringing into our discussion today, because from a holistic standpoint, we always want to stay ahead of the game as much as we can and be as proactive and preventative. So let's talk about that group of ideas for this topic. And what I would like to start out by saying is all chronic issues are inflammation based. So whether you're talking arthritis and back pain, or you're talking, anything, heart disease, cancer, I mean, everything is inflammation based. So from a holistic and a functional medicine standpoint, I am always looking at my patients as to how can I support decreased inflammation in their body? How can I help this pet to reduce inflammation? Because anytime you reduce inflammation, you're going to age more gracefully, you're going to have less pain, you're going to have less disease, and so forth. And so that's really, a key approach. And the first thing to reduce inflammation in my approach is to get them on a healthy diet, to get them on the freshest food diet possible, because as most of our audience probably knows, our group here knows, that if anybody's eating, us too, a processed food diet, you will have more inflammation in your body. So a pet that eats kibble and processed food will have more pain. I mean, plain and simple, really, they will have more pain as things occur in their body over time, simply because they're going to have more inflammation. So a fresh food diet reduces inflammation right away, which is awesome. Other things that we can do to reduce inflammation is, as we talked about, musculoskeletal issues are the most common problem. So thinking of joint support, being really proactive in taking care of the joints so that we have less inflammation in their joints over time. And one of the things that I'd love to bring up that's really proactive is weight management. And I'd love to share another example real briefly to give people a scope of how important this is. In reducing weight or getting your pet to be lean is literally the number one thing you can do for their joints proactively. Okay. And there was a study that was done several years ago now. This was shared with me by an orthopedic surgeon, a veterinary orthopedic surgeon. And they took a large group of dogs that all had hip arthritis. Okay. But you could extrapolate these results to any joint. You could be talking elbows or knees or, doesn't matter. But these were all dogs with hip pain and symptoms of that. And they broke them into 4 groups and they followed them out for an entire year. So it's a very well done study. And when they watched them walk to score how well they were doing, it wasn't actually just subjective from the viewer watching them walk. They actually had them walk across weighted plates so that they could measure how much weight are they placing on each of their limbs. So when they were documenting the results of this study, it was very objective. Okay, so done very well. They put the dogs in 4 groups and did certain things and then followed them out for a year. The first group, weight management only, got these dogs to a very lean body weight. Second group, joint supplements, things like glucosamine, chondroitin, MSM, like that. Third group did pain medication, NSAIDs, non-steroidal anti-inflammatories, which we can talk about, things like meloxicam and Rimadyl, carprofen, those kinds of things. Fourth group, they did total hip replacement surgery. Okay, they give these dogs new hips surgically. A year later, guess which group had the most benefit, the best, the lowest pain scores, the best mobility scores? The weight management group.
Lighter.
I mean, that is profound information, because why should we think about turning to drugs, which are not cheap? I mean, some of these drugs are $2 a day for your dog. And they tax the liver, they can tax the gut. I mean, NSAIDs, we know, can cause gut issues. They have side effects. Surgery is super invasive and expensive. And literally, weight management is the cheapest, the safest, and the most effective. I mean, win-win-win. It's like, that is so profound. So I love to share that with people when I can, because if you just tell people, let's get weight off your dog, they're like, yeah, I get it. I know, and you don't really understand the significance of it. And when you understand your pet will age more gracefully, you will not have to turn to drugs. You will not have to potentially do some surgeries that you might think you have to do. That's profound. So anyway, talk about proactive. Weight management is huge on the top of the list. Other proactive things we can do are wonderful things for joint support. Like, we can be looking at specific foods. A lot of people know that I love to talk about medicinal foods that have very specific benefits. Things like bone broth. Again, bone broth is my favorite thing to do for joints as far as like a supplement in food form. And then some quality omega-3, whether that's feeding sardines on a regular basis or giving a cod liver oil or a quality fish oil every day, that sort of thing. So joint support, because we know that, and omega-3s, by the way, are anti-inflammatory for the whole body. So they're not just helping the joints. So that's a wonderful thing. Other proactive things we can do and preventative things we can do, keep your pets moving. As they age, make sure you keep them walking and doing even just small spurts of things, not to overdo it. You don't want them to have to pay for it later. You don't want to take them out on a 10-mile hike if they're not, up for that, suited for that. But what I see oftentimes is multi-dog households. A lot of people, of course, have more than one doggy. And so oftentimes you'll have the young kiddos and then you'll have the older doggies. And it tends to be very difficult, obviously, to do a group walk when you've got kiddos pulling you and somebody that's dragging behind you. And so what I often see is that people will go out for the walks with the younger dogs, leave the older dog that may be arthritic and slower home, and just let them go outside in the yard and go potty. And maybe they don't really get out moving as much. And there have certainly been studies done in dogs, and obviously this would be the same in humans, that if you have arthritis or joint pain, if you just sit immobile most of the time, it gets worse because, obviously when you're moving, you get better blood flow, inflammation actually falls, your muscular mood, right? Yeah, mood for sure. That's a huge piece of it too. And then even just muscle, tendon, ligament strength. I mean, all that stuff starts to fade if you're not moving.
Yeah.
And so literally staying moving. And the studies that were done in dogs actually suggested from the results that you get them moving at least 10 minutes at a time twice a day would be excellent. And so it can be slow, methodical movement, just take them on a walk, don't push them. But if you can get them out for at least 10 minutes twice a day, that's enough to really keep blood flow, and keep symptoms more reduced and keep pain more reduced. So I think that's a really nice thing. There's also, swimming, PT and rehab. If you have those types of resources in your area, I highly encourage that. Any kind of low impact activity that you can do for them is always a bonus as well. So that's really proactive.
We've got a question here from Robin, our dear friend. Hi, Robin. What do you consider the best source of omegas for dogs and cats?
Oh, thank you, Robin. Hello. So yes, what I like to say is that omega-3 fatty acids, unfortunately, are you've got to be so choosy with quality. And there are literally a lot of health experts, nutrition experts in both human and veterinary fields that really don't even like fish oils anymore because they are so oxidized and poor quality. So with fish oils, any kind of omega-3 oils, you need to make sure that you are going with a very reputable company that not only sources these fish well, but they're batch testing everything to make sure there's little to no contamination levels of mercury and other heavy metals. They have to be cold pressed and not heated and stored well, packaged well. And then when you get the bottle, keep it in the refrigerator. As soon as that seal is broken, keep it in the refrigerator. And I will tell you, I even keep my capsules in the refrigerator. So theoretically, capsules, obviously would stay fresher than a liquid oil, as long as they're not in direct heat or sunlight. But I even keep capsules in my refrigerator. So, and I tell people, don't buy the large economy bottles. Get the smaller bottles so they're used quickly, they stay fresh. You don't want fish oils hanging around for a long time. And then to answer Robin's question a little more directly, I really like Nordic Naturals. I feel that they are still a very reliable, very good quality company. And then I also like Green Pastures, which is made for people. That's a cod liver oil, actually. Billy Hokeman at Answers loves the Green Pastures as well. And a lot of naturopath human doctors recommend that one too. And that can certainly be used for dogs as well. So, and then omega-3 pet is made for dogs and cats. And so those are really good choices. And then going straight to the food source, sardines. So,
Yep. Well, exactly. Right. Just take out all the middlemen.
Right. Exactly. I mean, and what I usually tell people, and for Robin's case too, is that my feeling is if you're going to use standard fish oil, you might as well feed the fish. You might as well feed the sardine. That's why I've come to really like cod liver oil as my supplement choice from a bottle, because cod liver oil is very unique. It's coming from the liver organ of the cod. That's kind of hard to do as a whole food. But fish oil, you can just feed fish. And human health experts too will tell you, try and eat fish smaller than your dinner plate. Salmon and tuna are generally caught as enormous, big fish, and they have had more time in the ocean to accumulate heavy metals and mercury and contaminants. Sardines and anchovies, teeny tiny, bottom of the food chain, not alive very long. They're estimated to have little to no contamination in them. So they are safest, they're cheaper, and dogs love them. And most cats love them too. So that's a really good place to get your fish oils in a fresh way.
Before we move on from the prevention, let's just answer this question real quick too from Kate. Is 10 minutes of movement twice a day for seniors or all dogs?
Well, younger dogs, I would do more. Actually, the goal for younger dogs would be an hour a day. And you can exceed that. Don't feel like you have to stop there. But an hour a day would be awesome. So whether that's 2 30-minute walks or 3 20-minute walks or one, but definitely younger and middle age, I would exceed the 20 minutes if at all possible, or at least most days,
Great. And just to, oops, wrong one. Thanks. That was my brother. Thanks, family, for your support. Rhonda, I just wanted to mention to you, this is Dr. Katie Kangas. I'm Amanda Rhee. I'm the founder of Sama Dog, and Dr. Kangas is the founder of Integrative Veterinary Care. So toward the end, I'll put up our websites, but just so you have them, it's samadog.com or intvetcare, intvetcare.com, just so you have that info and can connect more if you'd like to. Oh, thank you, Trish. She's on it. There we go. Awesome. Let me just see if there's anything else. There is a question about food and species appropriate diet. I feel like that will take us a while to cover that. So why don't we get into the treatment more first, and then we'll come back to that if we have a little bit more time at the end.
Okay,
So,
great.
yeah. So Dr. Kangas, tell us, natural treatments. I mean, some of them you've already discussed and mentioned. If there's the actual pain has come up, what can we use? What can we not use? What's the best steps to take?
Okay. Great topic. And I'm trying to decide if I want to start with, I think I'm going to start with the hands-on therapies first, and then go into things that you can easily do that are like products, things that you can give. Because I think that topic's going to open up a whole bunch of questions, and, we can kind of go from there into some nice discussion. So let me start out by saying that there's a lot of ways that we can safely and naturally support better comfort in the body for our pets and ourselves, for that matter, because everything we're talking about today applies to us as well. And so there's a lot of things that we can do that are safe and natural to support our pets. And I wanted to start out by talking about the hands-on therapies if you have access, and if these are things that you can do for your pet, if you have somebody in your area. I wanted to run through a list of wonderful therapies that are very, very good options to benefit your pet. And the first one, acupuncture. Most people are very familiar with the fact that acupuncture is certainly used to reduce pain. And acupuncture can be used for anything, honestly, but reduction of pain is one of its highlights. And even in human medicine now, a lot of insurance companies, health insurance for people, will cover acupuncture if it is for pain. They may not cover it if you're doing it for cancer or liver disease or whatever, but it's very well recognized and established with modern day studies to show that acupuncture absolutely can reduce pain. Okay, so that's a wonderful modality. And then chiropractic. I absolutely love to recommend chiropractic, and it's because I see remarkable results with that modality. And so indeed, I have a chiropractor at my practice, and she is a human chiropractor, a DC, as well as a certified animal chiropractor. So if that is something that you have in your area, a lot of human chiropractors, people will say, oh yeah, my chiropractor will see my dog and we get to take my dog in with, and that sort of thing. But remarkable benefits with chiropractic. And I've literally seen instantaneous changes. Doesn't happen all the time, but immediate changes. Just the other day, I walked into a room. I had done a Zoom session with this particular pet mom a few days prior as our intro meeting together. And she described this very, this older doggy, who, by the way, was overweight as well, this like 14-year-old golden retriever. And she's like, she's so recumbent. She's, it's hard for her to get up. I have this harness to help her get up. I don't know how realistic it is for me to bring her in for chiropractic and therapies, because I can't really even get her in and out of the car very well because I'm by myself, but I'll have my neighbor help me and I'll get her in at least for one time. So when she came in, she actually, the way that the appointments were booked, she actually saw the chiropractor before she saw me. So Dr. Aubrey went in, did her chiropractic thing. I come in the room and I walk in, and this dog is standing around and walking around the room and doing all that stuff. And I expected to come in and see this down dog. And I look at mom and I'm like, oh my gosh, she looks great. And mom's like, yeah, I can't believe what just happened. Like, she just responded so immediately to that chiropractic session. She's like, she didn't even lay down for the appointment. I mean, it was a brief appointment because we had the Zoom prior, but she didn't lay down at all. And she totally tooled on her own right out the building.
Wow.
I mean, it was remarkable. So we see these kinds of things all the time. That's what jazzes me up to recommend chiropractic. But what I like to tell people is certainly it can reduce pain, but it will keep them more functional. They will age more gracefully. They will have better maintenance. So if they're athletic dogs, if you're doing a lot of agility and they're cutting and tearing, if they have a lot of play groups and they're going to daycare and they're roughhousing with other dogs, things get out of alignment. If they're older and they've got inflammation and arthritis, I mean, there's so many scenarios. Back pain, oh my gosh, back pain and neck pain, chiropractic, so as well as acu. But anyway, you can tell,
share this.
I love that.
Yeah, well, and that's why I wanted to share this from Rhonda, another great story. And, these tales can really guide us. My dog was cured of incontinence by a doggy chiropractor. And she even had been seen in Davis to be evaluated, and they could do nothing for her except operate. Isn't that amazing?
Thank you, Rhonda. I just got the chills too. And I'm so glad that Rhonda contributed that for numerous reasons, because people really get an understanding of how impactful this can be. But the other thing I love about Rhonda's comment is that I also like to tell people that chiropractic, the value of chiropractic goes way beyond musculoskeletal. And most people only think of chiropractic for themselves or for their pets with pain or mobility or, function. But chiropractic, because the whole body, every organ, you got it, relies on the innervation, the alignment of the nerves and the nervous system going to all the organs. And so chiropractors will tell you they can have phenomenal success with IBD, gut issues, asthma, bronchitis, allergies. I've had people tell me my allergies went away when I started getting chiropractic. And then Rhonda's great comment about her doggy's bladder too. So that's just wonderful.
That's great.
So,
okay. Yeah.
More therapies. Okay. So
there's many to talk about.
I had to go off on my tangent with chiro because I love it so much too. And then other therapies that are really nice for addressing pain include things like laser therapy. And that is something conventional vets offer, the vast majority now. And they will offer laser packages, and you don't even have to see the vet. You just go in and the technician, team will do laser therapy on your pet. And that is done with, lasers are light wavelength energy that is communicating to the cells. Everything's energy. And so the energy of the light is actually helping to modify what's going on in the cells to increase blood flow, decrease inflammation, stimulate anti-inflammatory mediators and pain reducers and stuff like that. So laser's darn cool and hands off, not invasive. If pets don't like to be poked, if they don't like to be touched, laser's a great option. If they're in a lot of pain and they're like, don't touch me, I don't want chiropractic today or whatever, laser's awesome. And then another tool that you can use at home is something called an Assisi loop. And maybe we can put a link to that out there later, but if people haven't heard of or seen these loops, yay! Assisi loops are a wonderful technology that are this small handheld loop that you can place on your pet or place around a limb if they've got a sore joint or limb. And it's basically a 15-minute treatment cycle that is the technology that's being used is different from laser. It's not a light wavelength, but the effect of what's happening in the body is essentially the same thing. So all the things I just described is what an Assisi loop is achieving, and it's doing it through what's called a targeted pulse electromagnetic field. It's a tiny electromagnetic field. I'm big on electromagnetic field toxicity. So just for everyone's understanding, this is estimated to be like 1,000th of what your 1/1000th of what your cell phone's putting out. I mean, it's tiny, tiny, and it's targeted and pulsed, which means it's even safer to the body. It's targeted to act on certain pathways in the body that reduce inflammation and speed healing. So the CC loop is a wonderful thing. And then you don't have to go into your vet to do it. You can do it at home. So you buy a loop and do it yourself. And then,
Dr. Katie, quick question about acupuncture. Are there issues with dogs staying still? Can injuries occur if they move about?
That's a great question. Yeah. So I've never seen an injury happen. Okay. And people ask me all the time because I'll put needles in. They're like, can they lay down? And I'm like, sure, they can do whatever they want, And my feeling is, and I'm sure most holistic or acupuncture veterinarians are of the same protocols as me, but my personal protocol is if I have to restrain a pet, use any not force, but you know what I mean? If I have to do any effort to restrain them, I'm not going to do acupuncture. If they really don't want it, we will find another modality. And the great thing is if they don't like to be poked with needles or they're really sensitive, then chiropractic's a better route, or massage, or laser and these other things. But the majority of pets, I would say at least 75%, 80% of pets will accept acupuncture needles. And fortunately, when you're as experienced with, I've been doing this for over a decade, when you're as experienced as I am, I'm very quick. The way I place the needles is quite, quickly. So, they're not feeling a whole lot. I also have, oftentimes I will have the pet parents feed little tiny treats, just to distract them, and so that they're thinking about the food and they're not thinking about what I'm poking in their back. Okay, so that's a really nice thing too. But I let them walk around. Once they have the needles in, they can do their thing, they can lay down, they can walk around. Most pets, it's nice if you can encourage them to lay down. They'll usually keep the needles in better because we like the needles to sit in for 15, 20 minutes. We just, the biggest downside of acupuncture with dogs is if they do a full body shake. You put the needles in and then they shake and half of them fly out. And it's like, darn. And you can't control that. And so, we do our best. And if they retain most of the needles for most of the time period, we're doing awesome. Most pets will lose a few needles, but I've not seen an injury. The one thing that I really like to make sure doesn't happen is for them to eat a needle. So if I put a needle in a leg or a spot that they can easily get to, and I see them going for it, like that's really bugging me, I'm going to grab it out with my mouth. I take it out first. And I go, okay, that one, they didn't eat that one today. So that would be the one thing I really try and avoid is them eating a needle. Other than that, never seen an injury.
Great. Okay. So I kind of interrupted you there in your flow of other therapies.
That was a great question. That was a great question. So then I'll go on with my little, good thing I have a list so I don't forget.
Yeah, exactly.
Yep. So the next thing I had on my list was massage. So we talked about the acupuncture, the chiropractic, the laser, the Assisi loop. And we also at my practice have a wonderful certified canine massage therapist. Linda Olenek is my associate that does that. And that is an extremely wonderful thing. And actually, Linda is very diverse in her skills and talents. And she not only does traditional massage, but she also does healing touch, which is more energetic. And I kind of think of it like sort of a cross between Reiki and massage, where it's more energetic in its nature than actual massage, but there is some touch involved. There's some light touch. And of course, Reiki is hands off. You don't even need to touch. So healing touch is a wonderful modality. And I get tremendous positive feedback from what Linda does with our patients at my practice. So that is really wonderful. And I oftentimes, if they're not a fan of needles, if the pet really doesn't like acupuncture, I will definitely recommend to work with massage therapy and healing touch in lieu of, but I also recommend to do it alongside or in alternating. And some people find that their pets do better if they come every other session for a different therapy. Like we do acupuncture, and then the next time the pet comes, we do the healing touch and massage. And then the next time back to acu and alternate, that kind of thing. So that is a really wonderful thing too. Don't discount massage. And the fun thing about massage is people can do that for your pets at home.
I was just going to say that. Both we can learn to do ourselves, right?
And I'm sure there's all kinds of wonderful videos on that. And I'm sure there's good classes and, online courses and things that you can do. But what a beautiful way for you to provide some comfort and bonding time with your pet at home. And I get so proud of people when people tell me I massage my pet every day, and this is our morning routine or this is our nightly routine. And, I do that too, of course. But it is a really wonderful thing. And it's, something that you can enjoy doing for your pet. So, and with your pet. So that's a wonderful side note.
Yeah, I have to say too that in our course, Dog has a course called Ayurveda for Dogs 101. It's like our starting point with applying Ayurveda, the holistic healing science of the East. You can learn to wrap this into your dog's life. And that's what Sama Dog mostly focuses on. And so in this introductory course, we teach so many things. One of the things is massage, specifically for one of the doshas. It's even a little bit better. And, that's what they learn in the course. And I share this because that is the most common feedback long-term that I'm hearing from the course. Although people learn so much about food and lifestyle, and we go through each of the senses, when it comes to that sense of touch and massage, that's the one that is most, I think people just kind of take to most and is so effective and will keep going. I have clients now, 6 years ago, they started massaging their dog on a daily basis, like you said, and they say it was a total game changer, not only for the physical health, but as you just mentioned, the bond, the connection, the feeling their body. Here we are now in this foresty environment, and a whole new thing for us is ticks. We've come into the world of ticks very strongly in this forest. And so by doing my massage the other day on Violet,
you're finding stuff.
Yep, you're finding stuff. You find those little, bumps or bugs or scratches, scabs. You know what's going on with that body so much better.
I'm so glad you brought that up. And I will back up and say, what a remarkable feedback or comment for you to give us, that all of that tremendous content you give in your courses. And that's the thing that people really tap into to the highest level. That's remarkable and really neat to hear. And secondly, I'm so glad you just brought up the fact that touching them all the time is such a way to be in the proactive, preventative health mode in, as your pets age. And so when you're feeling them all the time and doing massages, you're going to be, more likely to not only find ticks and parasites, which is hugely important, but also those lumps and bumps and, tumors and other things that are going on, or even wounds and things that you might not see under the hair and hot spots and stuff like that. So I love that you brought that up too, because it's really valuable, just that piece.
Mm-hmm. And just touching their paws. Many dogs are very sensitive, surely cats too, sensitive to their feet being touched. And so if you're massaging it and you're in this very rejuvenative, like calming vibe with the animal, they're going to allow you to do that a lot easier. And then when they go to get their nails done, or you're trimming them, they are so much more receptive and comfortable and have had that experience. Same as their face, their ears, it's just so good to have that physical connection with their whole bodies.
So true. Perfect. Yeah. Oh, I'm glad that came into the discussion. And then the last thing I had for the modalities, which I just mentioned previously, is the PT and rehab. And so if there are a growing number of animal physical therapists, pet physical therapists. I know that on a previous Sama Dog episode, we had a tremendous physical therapist that joined us, and I think she's in Tahoe, right?
Yeah, she's around this area, Dr. Mo.
Yeah. So really such a useful modality. And I've grown to very much appreciate the tremendous benefits that pets will show with that too. And, with the specific knowledge and skills that these practitioners have to help support the body into better mobility, better styles of movement, giving the pet parents homework. Like, these are stretches you can do at home. These are passive, stretches and movements you can do. And these are specific activities that you can encourage your pet to do that are going to be better for their body than these others. And so really keeps them in not only a better current mode, but that's a really wonderful ongoing prevention and just aging more gracefully modality to do too. So
important.
Yeah.
Trish mentioned this. She did ozone treatment with the healing touch, and it was amazing for her boxer. You want to mention what is that about?
It's funny because I almost was going to go into ozone. I'm like, well, I'm going to take up all our time before we even get to the product. So
a little mention.
Yeah, and I know we clicked in a little late, so hopefully we can go over a little over. But thank you, Trish, for bringing that up, because I thought to also add that in when I brought up the fact that my associate practitioner, Linda, who is the canine massage therapist, she also performs at our practice. She does laser for us, and she does our ozone therapy for us. And ozone therapy is a lesser known modality, but certainly very, very common now within holistic realm. And ozone therapy is, it's so versatile. You can use it for anything. It's like acupuncture and chiropractic. I mean, literally it can treat anything, but ozone is very widely known to be a very effective and beneficial treatment for cancer, but also for pain and for better mobility, and because it's just oxygenating the tissues more. So the tissues can respond and thrive, things can heal faster. And so it's used for back pain, it's used for all kinds of things, and also it's used for infection. And so ozone will naturally kill all kinds of microbes like bacteria, fungal, viral. When the pandemic came out, there was a bunch of, good information that came out about ozone for antiviral, but it applies to pets in all of these, categories of benefits too. And ozone can be administered in numerous ways. We generally give it rectally. It kind of looks like you're doing an enema, but without liquid. There's gas going in. It's very quick. It's very easy. Pets usually do not mind it at all. But ozone can be delivered in other ways. It can be given IV. It can be given in subcutaneous fluids. It can be applied directly to wounds. There's actually ozone creams now, or oils that are made. You have to keep them refrigerated to keep them stable, but you can actually topically put ozone cream on a tumor or a wound, and it'll, heal faster, or, slow the tumor and address that. And so lots of ways that ozone can be used.
Wow. It's fascinating. I didn't know all of that about ozone. And I just want to mention, look at all the therapies that we have at our, depending on where we live, but at our reach for our animals without turning to drugs or before turning to drugs, where most of the time in conventional veterinary offices, I would assume that we go in, our animal has some joint pain and we get that pharmaceutical. And we'll talk about that a little bit, because there certainly is a time in which we don't want our animals to suffer too much, and that's necessary. But we might think, well, what else could we do? And look, we just answered, you mentioned 12 things.
Isn't that cool? And we didn't even get to the point of like the herbs and other things that we can use orally. So that's why I thought it'd be fun to start with that, and then we can launch into the piece of discussion of what can we actually give our pets that will help address pain that's natural. And then we can step into, the pharmaceutical part of it too, or the prescription medication. So I actually grabbed a couple of things just to show for show and tell. But I mean, there's numerous things, and every practitioner, every holistic vet is going to have their preferences, or their things that they've used more than others to recommend based on their experience. So I just want everybody to know, the gamut is open. I mean, there's a lot of different products out there, but I can show a couple of the ones that I like to use, that I have good success with, and that I really like the companies that make them. But, there's all kinds of different herbal formulas that can be used to provide better comfort for our pets, to decrease inflammation, and to specifically address pain. And there are herbs in the Western herbal category. There are herbs in the Chinese herbal category. And then I kind of consider CBD to be its own category of amazing plant medicine. But it doesn't really fall. I mean, I guess it falls into Western herbs because it is a plant here and not a Chinese herbal formula, but it's just so unique. It's kind of in a different category for me. And I know Robin Lynn is attending today, and Robin is a CBD, or a certified cannabis herbalist expert. And that is who I actually refer my clients to get really expert advice on how to choose and how to use a CBD product that will be effective and safe and quality and all that kind of thing. So anyway, CBD is definitely a great category. I mean, since I started talking about that, I'll just allude a little bit more. I have seen it to actually surpass the efficacy of pharmaceutical drugs. Okay. So don't discount if you have a good product, especially if you have a guide like Robin Lynn to help you to find a quality product, that can actually work better oftentimes than prescription medication. And I've seen CBD work better than gabapentin and all kinds of stuff. Okay. And I really like that option for cats. I mean, don't get me wrong, it's awesome for dogs, but the special issue about cats is they are so sensitive to a lot of pharmaceutical drugs. There are so many things that are safe, relatively safe to use in a dog or a human, that you absolutely cannot use in a cat. Wow. And so for a long time, and still really, cats tend to suffer with more pain than dogs, because there simply aren't drugs out there that we know are safe enough to give them chronically, long term. And so cats just have to deal with it, and dogs will be on carprofen and, the Rimadyl, the Medicam, I mean, all these things, and cats get nothing because it's not safe for them. They would have all kinds of health issues and even fatality. So that's a good point. So CBD, really lifesaver, game changer for cats, but for dogs too. Okay. So I just wanted to put that piece in there. And then I can start talking about other herbs, unless you want to.
Yeah, no, I think just inviting all of you, if you enjoy this conversation, I really encourage you to like this video, share this video, subscribe to our pages, because as I listen to Katie and I see that you all have the same experience, it's like, oh my gosh, this is the information I needed to know. And that's why I say it again, because it's not super available, right? It's not everywhere on the internet. And even if you can find it, you don't know if it's a trusted source. So here we have Dr. Kangas, here we have Samadog, always coming to you with the best information that we can offer. So please stay connected with us in this conversation, this and so many others of our future, because this is what it's all about for us. And we know that it can help all of you so much. Yes, we do want to go on. We can take a quick question since we're somewhat on this topic. Well, I do want to just mention one thing here. We talked about, kind of being at your wit's end, right? So Jana Marie says, I was at that point. What else could I do for my kitty's ears? A vet couldn't figure it out. I sprayed colloidal silver spray in the ears and no more problem for 10 years now. That is amazing. So there you go. Just
Yep. And colloidal silver, just to explain for people who aren't really familiar with colloidal silver, it's not addressing pain. But the thing is that colloidal silver is a fantastic natural antimicrobial. It will address viral, fungal or yeast and bacteria. And so, this is such a great example where I have seen colloidal silver be phenomenal for eyes, ears, anything. The great thing about colloidal silver is if it's a quality product, it's very safe. It can go in the eyes, it can go in the mouth, it can go in the ears. And I've actually had other kitty patients similar to this person's experience where they've gone through lots of different other veterinary, visits for ocular stuff and conjunctivitis symptoms that wouldn't clear up with regular medication. It wouldn't clear up with anything. And then put colloidal silver in, boom, solve the problem. So pretty amazing. And ear infections are painful. So the nice thing about, this feedback for us is that when you find something natural that works to keep the ears in a healthier place, then you don't get the ear pain, because everybody knows ear infections are ouchy. Those are not comfortable. So it's really nice that a natural tool was so effective and eliminate the evolution of pain in those ears.
Colloidal silver is a homeopathic, right?
It's not. So yeah, it's different. And colloidal silver, and I wouldn't be able to explain it extremely well, but it's like, it's an element that's coming from the earth. It's mined from certain places, but colloidal silver is very unique. It is a silver metal, but there's something very specific with the elemental makeup of it, the microns, whatever. But it is literally dates back to the ancient Greeks and Romans as the original antibiotic. I mean, they use that for an antibiotic, but it also has antifungal, which is yeast properties, and antiviral properties. So people will, Glacier Peak Holistics makes it in a spray bottle. That's what we carry. You can spray wounds with it. You can spray it in the mouth. You can put it on a little swab or, a Q-tip to, put it in the ears, or to, you can get a little, saturate a little cotton ball with it and just squeeze it so it goes into the eyes. I mean, there's all kinds of ways that you can use colloidal silver as long as it's a quality product, because there are some products out there that wouldn't be as safe. So you just need to make sure, and Glacier Peak Holistics, I know, is an incredible product. So that's one that I can offer as being a good choice. But certainly there could be other good choices as well. So
in the little bit of time we have, why don't we kind of sum up some of the last points, take a few questions, because I don't want to jump around with the questions too much and get us, way off track. So you can go ahead and finish up with what you were going to show us.
Okay, great. Yeah. So we talked, so I kind of started this section by saying, there's a lot of things in the natural oral supplement kind of category that can address pain. And we've got Chinese herbs, which is like a whole other category. I mean, they're very specific based on pattern. So we won't go into that too much. Just know that there are some very effective things for pain in the Chinese herbal category. And by the way, I'll just make a quick note that with back pain and cervical pain, spinal pain, Chinese herbs are awesome. So I use them for that a lot too. And my mentor, Dr. Keith Weingart, one of the formulas I use from a specific company, Jing Tong Herbal, is called double P2 for paresis and paralysis. Paralysis when, they can't even use their back legs or their legs because there's, because of a spinal problem and they're in such pain. But Dr. Keith used to call it magic in a bottle, and literally, I mean, I've had dogs that come in not walking, and granted we're doing acu, but these herbs can dramatically reduce pain and help dogs back to function. Okay. So just very, very powerful options. And then there's the Western herbs and the CBD. So I already talked about the CBD. We'll move over to other Western herbs. And again, there's a lot of things in these categories. Some things that people will be familiar with. There are things like boswellia and poppy, skullcap, formulas that have multiple things in them, or even just some single herb formulas. One of the products that I use all the time, let me find my camera, Comfort Plus from Animal Essentials, has California poppy to address pain or analgesia, and there's also skullcap in there. And skullcap is a very nice herb to use when there's any muscle pain or muscle tension. So especially if there's back pain or even arthritic pain, a lot of people know if you have back pain or neck pain, your muscles will tense up around it, and then it makes everything worse, and it's sort of a vicious cycle because the muscles will pull on the spine, and then all the inflammation just gets worse. So this is a formula, this Comfort Plus, that can be used for anything, but it also helps to relax the muscles along with addressing pain. And so that's just so much better for the body to heal. People will know, if they take a muscle relaxant, they're like, "Whoa, I slept so good because my muscles are relaxed," And so it's like you can really just rest. And so if you have a pet that's, agitated or painful, sometimes that ingredient in there will really help a lot too. So that's one of my favorite formulas to use. And then I'll just show a couple of other things that I use pretty frequently. I mentioned the Glacier Peak Holistics Company. That's their logo there. They have a product called Inflapotion. It's a little sample packet, and it's capsules, but it comes in powder. They also have a product called, oh no.
What, you're there? You're good.
Oh, and then there, okay, I touched something on my screen. I thought it went away. Sorry, guys.
Nope. Okay.
Then they also have a product called Herbaprin. Okay. And those are supplements that, they're all herbal, they're all natural, organic ingredients, great products that can be used for pain and for inflammation. Inflapotion can be used in dogs or cats, Herbaprin specifically just for dogs, because there are, as I mentioned, things that are not safe for cats. And this could maybe lead us into what not to use in the pharmaceutical category, just like over-the-counter things at home. But certainly things like acetaminophen and aspirin can kill a cat. And they can be a big problem for dogs too. But cats are much more sensitive to the toxicity in those kinds of things.
Cats, yeah, they're just so sensitive in general. And is there anything else? I think I mentioned to you, Dr. Katie, that I'll often hear from people, "Oh, can I give my dog a baby aspirin?" Can you give your dog a baby aspirin?
You can. Now, aspirin, is okay for the most part for dogs. The big issue, and a baby aspirin would be safer. And, it depends on the size of the dog as to what I would recommend. And honestly, when I started veterinary medicine 25 years ago, more than 25 years ago, we were still offering that as an option to people for their dogs. Like, you could give an aspirin, but we would tell them exactly how much to give, and best to be a coated or buffered aspirin so it doesn't, affect the stomach lining and cause gut issues. But you definitely don't want to give it to a cat. And acetaminophen will kill a cat. It's very, very toxic to cats. So, but baby aspirin can be safe. But there's so many better things out now for dogs that people rarely use aspirin anymore, because there's other things that are just safer and better. So
good to know. Very good to know. Well, you want to take a couple questions?
Sure.
And then we'll finish this up for today. Thank you all for hanging with us, for your interest in this. I mean, there's still so many of you on. It's awesome that this clearly is landing for you in a place that is helpful, useful, applicable to your life. So we're so happy that your pets will be in a little less pain after this conversation, maybe a lot less pain. Well, this is a big topic, but just as far as a reference guide for food, Cynthia, we have many other Facebook lives that we have done, other Sama Saturdays with Katie on the topic of food. So you can resource all of those on our YouTube channel. But Dr. Katie, is there anything that you typically will recommend people to kind of as a first step?
Yeah, I mean, that is such a big topic. It really depends. And maybe what we can do is provide a little list. I would say, just off the top of my head, probably the first resource that I would choose would be Dr. Karen Becker's book, Real Food for Dogs. I think that's a great place to start. What I can share with Cynthia is that, because when it comes to food, you can select from so many categories. You can be talking raw, you can be talking, cooked food. Obviously, I like to see pets eating the freshest food possible that works for them, that works for the family. But it has to be balanced. And so that's the thing is I no longer really, encourage a lot of home preparing unless people are really willing to go that extra mile and get really good training and good resources to do it right, because most home prepared diets are unbalanced. However, that said, I always recommend to garnish whatever the diet you choose as sort of the main portion of their diet that is fully balanced or perhaps professionally balanced, but then you enhance that diet with wonderful things that you can do, and a lot of things that Amanda would talk about in the well-being course, for dogs, but also the other little add-ins that I talk about, like the bone broth and the sardines and the eggs and, raw dairy and fermented foods and all that kind of stuff. But as far as a guide, I think Dr. Karen Becker's book is a really good place to start. And then there's other websites and resources that I could offer too.
Mm-hmm. And same here. So just reach out to us. This is a good question. I don't know this. Moxibustion for dogs.
So I'm assuming that is it's something that's done in acupuncture where you are burning a very specific herbal stick that honestly smells like marijuana. And it heats up. So you can do this with or without needles. And I actually don't do it. We're all trained to do this in acupuncture school. And some human acupuncturists do it. Some veterinary acupuncturists do it, but not everybody. And partly because of the fumes and, the smoke and, stuff like that, although you can get ones I think that are more smokeless. But certainly it has application. And a lot of acupuncturists do like to use that. And so you hold this little stick that basically, it doesn't have a flame coming out of it, but it is burning, and you hold it close to acupuncture points and meridians and things, and it can actually stimulate with or without a needle in an effective way. So.
I didn't know that. Robin has this question, and I know that Karen Becker, who we just mentioned, and Rodney Habib recently did a wonderful Facebook Live. So those are two great teachers to follow. They did a Facebook Live all about omegas and the specifics of which are good for dogs and the resources or the sources to get them from. So her question here is basically around hemp oils or, hemp.
CBD.
Well,
okay.
She's asking hemp CBD. I was looking at the omegas, and
right.
the different sources and how that affects animals versus people.
Yeah. And I think what Robin's getting to, and I think it's a great point to bring up, is that a lot of people think that food grade hemp has medicinal CBD in it, or even that food grade hemp is providing omega-3s for their dogs. And that is not the case in either scenario. And so just to let everybody know, when you are providing omega-3s for your pet, it really needs to be from either a fish oil source, like an animal source, or a marine, like plankton, phytoplankton, that kind of thing. Plant-based, like flax and hemp, omega-3s, dogs are getting very little of that, and cats are getting like none. Okay. Their bodies do not have the ability to convert the ALAs, which these are the components in the plant-based oils, to what's the omega-3 that we're thinking of that they need, which is the DHA and the EPA. Okay, so humans can do some of that conversion, but dogs can do very little and cats can't do any. So when you are giving a dog or a cat hemp, food grade hemp or flax, they are not getting omega-3s out of that. So just know that. And not that it doesn't have some benefits to it, but I generally tell people, if you're going to give flax to your dog, instead of a form of an oil, I would give ground flax. At least they're getting some of the other nutrients and some of the fibers, and it's a little more of a complete food offering, but do not rely on that to be giving them a good quality omega-3 source. So that's a really important point. Yeah. And then the other thing is that a lot of people think that if it says hemp on the label, that it's a CBD product. Or that's an effective, CBD, like a medicinal CBD. And so and the market is so flooded, as everybody knows, there are a ton of products out there that are in the form of treats or in the form of, oils or whatever that just say hemp. And a lot of them are multiple. I see products all the time that are joint support, and there's all this stuff in here, and it'll say hemp. And it's like, well, that may not have any CBD, actual, active CBD in it. So I think that's a very good point to make for people.
My gosh, so many fantastic points touched on here today. I mean, really such a wide array of things, from how we can touch our animals, how we can feed our animals, what we can give to them, what are the resources out there for us. So we hope that you've all have enjoyed this and taken so many little tidbits. Even if you just got one aha through this conversation, that can be the game changer for your animal, as we've seen in so many of these various testimonials. So I want to show Dr. Kangas's site one more time. Just know that she is a available for consultation via Zoom. So no matter where you are in the world, you can meet with her as well if you're not in the San Diego area. And we just thank you so much, Dr. K, from the bottom of our hearts. I mean, my gosh, what you have done for so many of our animals and our human selves. So thank you again.
Thank you for having me. My pleasure to be here with everybody and be, connecting on such important things to help everybody's pets and themselves.
So thank you all for being with us. Let us know if you have any other questions. Put them in the comments. We'll keep our eyes on things. You can always just reach out to us via email or through our other channels. We do our Sama Saturdays, usually once a month. And Dr. Kangas is very commonly with us for these. So stay tuned. I'll always be sending out some emails, keeping you all in the loop. Make sure you're in our database. You can do that on our Sama Dog website. I'll just put that up. Thank you, Trish, for putting those into the chat there. And we hope you all have a wonderful rest of your day. Many blessings to you and your fur friends. Thank you, Dr. K. We'll see you soon.